So today we're going to talk about dementia versus Alzheimer's, the differences between them, statistics, warning signs to look for. A lot of people today get them confused because they think they're the same thing, but in all actuality there are many differences between them, and it's taking a lot of lives actually today, and the numbers are only increasing. So my name is Courtney Figueroa, and let's get started. So first of all, what is dementia? It is a chronic or persistent disorder that obviously occurs in the brain. It starts off by a set of symptoms marked by memory loss, personality changes, just not being able to do your day-to-day activities. It can be caused by injury to the brain or like a disease in the brain. Maybe you fell really hard and you need to go get an MRI, and that's, just one thing that can maybe happen. And as I stated before, they are a set of symptoms. That's how it progresses. That's the difference between dementia and Alzheimer's, which I will continue to talk about soon. So some symptoms that I had already stated is memory loss, communication and language issues. Maybe you can't carry on a full conversation and you just forget what you were talking about, or you repeat yourself a lot, that you just had said 10 minutes ago. Problem with reasoning and judgment. You can't really reason very well, make decisions well on your own. And obviously visual perception impaired, maybe blurry vision or just not being able to see as good as you used to. So what causes dementia? First of all, dementia is damage to the brain cells. And this is very important because we need those brain cells to work properly, for, as I stated, everyday activities, to walk, to talk, just everything. And a main component that gets damaged in the brain very often is called the hippocampus region of the brain. And this is where your learning skills, your talking skills, and usually that's the most common to get damaged, and usually the first. And obviously age and genetics, that has a big factor in it too. The elderly population, like 65 or, sometimes younger, they're the ones that can get it. And genetics, it just obviously runs in the family. If, generation after generation has it, then maybe you're just more likely to get it as well. So, diagnosis. When you go to the doctor and you have concerns about your loved one maybe having dementia, they'll give you a careful examination physically. They'll, look you over from top to bottom and just, maybe ask you some questions of what brought you in, some lab tests, maybe a brain scan or, something like that. Your medical history, maybe you have fallen or something, some kind of medical mystery or something that can be solved to explain it, or just examine your day-to-day habits, maybe forgetting your wallet or your keys, and that can be warning signs as well. And if you can see this picture to the right, it starts off with a normal brain, a mild cognitive impairment, which is kind of like early, medium sets of dementia, and then your Alzheimer's disease. So as you can see, as it goes on, the space in the middle of the brain expands more. And so the normal brain, there's a lot like filled in, there's really no space, and then it goes a little bit of space, and then boom, Alzheimer's disease. So risk and prevention, some things that you can do to not prevent it all the way, but at least put a damper in it coming on. So a diet, obviously it's very important. The most common one that they say is really good is the Mediterranean diet. So it's little to few red meats, fruits and vegetables, nuts, seeds, some oils, fruits, those kinds of things. Obviously exercise is very important, not just with dementia or Alzheimer's patients, but just for everyone, to keep your body healthy and in good shape, and that's obviously going to go a long ways for preventing diseases as well. And cardiovascular risks, that just means the blood flow and oxygen to the brain is very important because it really helps us do those everyday tasks that are needed. And so when there is a lack of oxygen and blood flow to the brain, it's going to be killing those cells and damaging those blood vessels, and that's really going to affect, put you at risk for getting Alzheimer's. So let's talk about Alzheimer's now. So it is the most common cause of dementia. It causes really about 50 to 70% of all dementia cases, so that's really about half. And Alzheimer's, it cannot be reversed. So the difference between Alzheimer's and dementia is Alzheimer's is like the final diagnosis of dementia. Dementia is just the symptoms. It's the onbringing of, forgetting things like slowly but surely. Alzheimer's is kind of like already too far gone. And as you know, as I stated before, 50 to 70% of dementia cases, that's half, and that's why it's such a big common thing, and that's how these two can get confused, because they are the same thing, but they are different as well. Is there a cure? Actually, there is no cure for Alzheimer's, because as I stated before, it's already too far gone. However, with dementia, you can get some drug interactions, like maybe some vitamin deficiency to help. Maybe that's what you're lacking, or, maybe you can get on some drugs that will help you remember a little bit more and kind of like help those brain cells. So some statistics. On average, survival time is about 4.5 years for people diagnosed with dementia. However, if you catch it early, like about 65 or younger, they say that you can last like a decade longer. So that's about 14 years because they've caught it. They can try to give you some, over-the-counter drugs to help you with that. There's about, from 2000 to 2014, which is about 14 years, 89% of deaths was caused by Alzheimer's. And they show that that has doubled over the years. It's only gotten worse, it hasn't decreased. And as well, if you don't know, heart disease is the #1 leading cause of death in the United States. But polls have showed that while the number of deaths with Alzheimer's and dementia is increasing, the number of deaths with heart disease is actually decreasing. And so that just goes to show that the numbers are only rising, and they probably will only continue unless they find a cure, or unless we can ourselves help prevent those chances. So 1 in 10 people age 65 or older have Alzheimer's diagnosed. So you may be wondering why Alzheimer's and why dementia. Everyone knows about this. It's such a common thing, and a lot of people suffer through it. But about 7 years ago, I had a great-grandmother who was my mom's grandma. She was diagnosed with dementia, early onset Alzheimer's, and she would forget, keys and wallet, and she would forget about who we were, our names, and it's common, your parent, yells your name, and they call you your brother and your sister, and then they finally get to your name. Like, it just happens. But after a while of always going and seeing her, she never remembered who I was, and so I took it personal. I thought, why me? Like, how can you forget your own granddaughter? But then my mom had told me as I got older what Alzheimer's was, what it does to a person, and that, it just broke my heart. And she ended up passing away because of it. And she was never the same person. And recently, my grandma, she is acting the same way, and she got diagnosed with dementia. And as well, my uncle is suffering through the same symptoms, forgetting things, forgetting about what they had just told us a few minutes ago. My grandma actually called my mom the other day at 9 at night, and she was like, okay, I'm on my way, I'm ready for my appointment. And my mom was like, what are you talking about? Like, it's at 9 the next day. She had just gotten confused, and she had just talked to her a few hours before that. And so, little signs like that just occur a lot more, and if we can stop it and nip it in the butt right now, it will not get so bad. So basically, what I want you to take from this is our bodies are very, very important to us. Your diet, and just take care of each other. Look out for one another. If you think that your family members are suffering through this, get them checked out, because if you stop it right away, it won't get any worse. And just enjoy every moment with your loved ones, your friends, and just don't take life for granted, because you never really know what can happen. We're never guaranteed tomorrow. So live in the moment, take care of yourselves, take care of one another, and just love life. Thank you.